In general, pharmacy has always been, being able to support patients and driving equitable access to care. When you have 65,000 pharmacies that are out there, the intent is that you are in every neighborhood. So when you look at Walgreens alone, we're within 80% of, 5 miles within 80% of the U.S. population. You take in all the pharmacy, it gets up to 90%. But 5 miles is a long way. It takes a while to drive, to be able to walk 5 miles or get a bus to 5 miles. And so we had to start looking at data in a different capacity. And this really came to light around 2020. And so we started taking a look internally at our own data, and we realized something that we always knew, but I think it was nice, to refresh ourselves, that over 50% of our locations are in medically underserved communities. So this isn't a one program type initiative. This is a part of our fabric of who we are. And when looking at that, we started focusing in our efforts on specific areas of areas that we know we can make an impact. The first was around making sure we were able to drive education. The lack of trust in healthcare is pretty evident. We saw that with vaccinations, we saw that with testing. There's a long history of the lack of trust that we have in healthcare in general. Our pharmacists are the most trusted professionals across the country in the industry, along with many other professionals, but pharmacists is in the top 5. So leveraging our pharmacists, our pharmacies, and the communities that we serve, it was going to be a key component of that. The second being around the ability to support partnership. And partnership, because we learned we cannot do this alone. When we look at partnership, it's faith-based leaders, community leaders across the organization, state government, federal government. It went from the public to the private sector and how we can actually make a difference there. And then the last one is around really health outcomes and how we can drive a focus in being able to drive the improved outcomes of our patients across the board. But we needed to focus in on, even within those areas, what we could drive. So we focused in on vaccinations and testing. That's something that was near and dear. We knew we could make an impact. I think all of us looked at where we could drive drive care in medically underserved areas or across the country. The second was around making sure social determinants of health was accounted for. So when we think of social determinants of health, it's not just clinical education, but everything else that we spoke about earlier, cost, transportation, what's actually driving some of these pieces. The third is around complex and chronic care management and adherence. And then the fourth is around health and wellness and making sure that we can drive health and wellness in a different capacity. So we've done a couple of things. One is we do have pilot locations. They're actually in the south side of Chicago. We have 16 to 20 locations where we test different ideas. We get feedback from the field. We get an idea of what's landing, what's not landing. What is the provider community saying? How do we test out different initiatives that we can then expand across the country? Healthcare is local. I can think of a lot of great ideas in Deerfield, Illinois, but that's not going to solve the problem. And so we have ambassadors across the country where they are our health equity ambassadors, where they're responsible for understanding what is a part of the toolbox and what is pertaining to the community that they're serving and tailoring those programs appropriately, but then also getting feedback. And so in addition, an example was the vaccine equity efforts we've had. In Atlanta, we had our biggest vaccine equity effort, and it wasn't because Walgreens did anything. We just identified the right partners. We identified faith-based organizations that mobilized the entire community to identify patients to get vaccinated. There's a bit of ownership on pharmacy as an industry, though. We've created a brand of convenience, but then also we get paid. Our reimbursement model is very much centered around the dispensing of medication, not the outcomes we've been able to impact. And so there is a shift that we as an industry need to do. We're at Walgreens investing quite a bit on transforming the operating model to have our pharmacists have time to have these conversations, because especially in very much Medicaid, Medicare environments, reimbursement rates are extremely aggressive, and time and capacity has become extremely tight. And so we've internally made a decision to transform the model to alleviate that. About 30 to 50% of our prescriptions we're looking to get filled at a micro-fulfillment center, bring that back into the pharmacy so a patient doesn't see any different, but at the same time it frees up that capacity of the technician and the pharmacist. There's barriers to the individual patients and consumers that we're looking to serve, and I think that's where social determinants of health really play a role in our level of education and tools that we can drive to help support health. We have internal barriers that we work through, and I think a lot of what was shared earlier, how do we demonstrate an ROI in this space, is going to be critical. There is an area, when we think of deserts, there's a purpose on how we've gotten to where we're at right now. There were independent pharmacies along, actually my family friends, my parents, we owned pharmacies in this area, in the Chicago, south and west side of Chicago. There were Walgreens and CVS's and Walmarts all around the area. And when your business is centered around reimbursement of pharmacy, and then you get locked out of those managed Medicaid plans for pharmacy to fill those prescriptions, and so patients can't even come to you for those prescriptions, it becomes really difficult to stay in the community. But it's much more at the state level and at the federal level of how we can impact policy to change that. Hence why in Ohio and New York and California, the fee-for-service changed so that any pharmacy provider can participate in being able to be in the network and get paid adequately. The cost to actually provide the service is such an incredible, important aspect of what we all need to focus in on, because that's what's going to help solve a lot of the desert issues we're currently experiencing. I think a part of this also is representation matters. It's so different so you see our CEO, Roz Brewer, who comes from a diverse background, our Chief Customer Officer, Tracy Brown, diverse background. You have individuals that actually represent the entire country, Caucasian, Asian, African American. I mean, it is a mix, and women, men, LGBTQ communities. That's in our leadership team. And that has allowed trust within our organization to believe in, okay, if they're saying it and I believe in them, I might do something about it. And so I think what has drastically shifted since COVID, and actually since Roz has really led the organization, is this view on how our team members can really be a part of the solution.